right, and we're back. Dr. Eliza here from Conquer Movement. In light of Valentine's Day, I wanted to talk to you about my favorite S word, salt. Right before we dive into that, I want to talk about your blood pressure and what that means. So when you get your blood pressure taken, you get two numbers. The top number is your systolic blood pressure. That is the pressure against your arteries when your heart is beating. That bottom number down here is your diastolic blood pressure, and that represents the pressure when your heart is at rest. So normal is 120 over 80. If you're right in that ballpark, you're doing great. And then on the lower end of that spectrum is 90 over 60. I've talked to a lot of people this week, mostly some of my very fit female friends that are on the lower end of that spectrum. But before you do anything, I want you to get your blood pressure taken and make sure you know what that number is, and if you fall between or if you're above or below. Okay, now that we have blood pressure covered, we can get into salt. As soon as I became a nutritional therapy practitioner, I learned the importance of salt, not only because it makes your food taste a lot better and actually brings out the flavor of your food, but salt is so important for all of your bodily functions. So I was listening to a podcast from Dr. Andrew Huberman. He is awesome if you haven't listened to him and you like science. He does a really good job of breaking it down, so I highly recommend. But one of the big takeaways that I got from one of his podcasts on salt was about the amount that you can actually consume. So there was a study in the Journal of American Medicine that talked about this hazardous risk ratio, and the study looked at the excretion of sodium. So it's correlated to how much salt intake, but it's not an exact number. But you can kind of extrapolate and say if you consume a certain amount of salt, you'll also excrete it at some point, that same amount. So the study was showing that around 2.5 to 5 grams of salt will actually follow more of a U-shaped curve. So you have a relatively low hazard risk around 2 grams a day. Now, as you continue to eat more and more salt, that number actually drops even lower, upwards to about 5 grams of salt per day. And then once you go beyond that, that number dramatically increases. Now, this can also account for things such as the salt from processed foods and sugars and fats and other things that are in those processed foods that really drive that risk up. But the study is basically highlighting that there's kind of a sweet spot between 2.5 to about 5 grams of sodium intake per day. Okay, so we've talked about blood pressure, we've talked about the hazardous risk ratio. What does that mean for you? Why do you care? So if you have consulted with your doctor and you find out your blood pressure and you find that it is normal or it's not normal and you got it under control, or you're even on the lower end, it shows that we have some wiggle room as far as that salt intake and how much you should be consuming per day. Especially for my athletes and especially for my super high intensity CrossFitters, F45ers, all of you. There's an equation that we can start to use to guide how much salt you should be taking. So if you take your body weight in pounds, you divide it by 30, that'll give you a rough estimate for the amount of water in ounces that you should be consuming about every 15 minutes of exercise. Now, that doesn't mean you need to actually set a timer every 15 minutes. All right, gotta wait, coach, I need to hydrate. That's not how it plays out. But you do want to keep it in mind as far as how much you should be hydrating when you are doing some serious exercise. So you want to be drinking plenty of water, and I recommend supplementing your water with electrolytes. Now, one of your electrolytes is salt, so sprinkling some salt into your water is a fantastic place to start. So what else you can do? You can either do the homemade version like I've been playing with for the last week or so, where you add in sodium, potassium, as well as magnesium, so you hit all of your electrolytes. Or you can get something like Element, spelled L-M-N-T with the letters, and that has all of those electrolytes in there just to help you really absorb that water and get your hydration levels up.